Hello guys, welcome back to the channel. Let us go through some arterial blood gas related topic MCQs. We hope you will find this useful. Question 1. A 30-year-old has been very anxious for the last few hours. She's breathing heavily, sweating, having a tingling sensation around her mouth and feeling faint. She was rushed to the hospital where an ABG was done and shows the following. The PO2 is 12, the pH is 7.46, the PCO2 is 4, and the bicarb is 22. What is the acid-base balance? The high pH indicates that the patient is alkalotic. The PCO2 is low and moving in the opposite direction to the pH, suggesting that the cause is respiratory. The bicarb and PO2 are normal. A normal PO2 would suggest that a panic attack is likely, as the patient washes out carbon dioxide via hyperventilation, making the pH alkalotic. A normal bicarb would suggest that there is no compensation. The tingling sensation that the patient is experiencing is secondary to vasoconstriction of the blood vessels. The decreased blood flow to the peripheries, particularly the hands and feet, leads to feeling of a tingling sensation or sometimes numbness or feeling colds in the extremities. So the correct answer in this to this question is B, which is uncompensated respiratory alkalosis. Let's move on to the next question. Question 2. A 25-year-old known asthmatic developed a cough and has had to increasingly use her rescue medication in the last 2 days. This morning, she woke up having a high-grade fever. By afternoon, she was rushed to the ED due to severe wheezing. An ABG done shows the following: a PO2 of 8.5, a pH of 7.3, PCO2 of 7, and a bicarb of 23. A chest X-ray done shows a patch on the right lower lobe. How would you describe the acid-base balance? The low pH indicates that there is acidosis. The PCO2 is high and moving in the opposite direction to the pH, suggesting that the cause is respiratory. The PO2 is low, suggesting that there is hypoxia. In this patient, there is both hypoxia and hypercapnia, which means that the patient is in type 2 respiratory failure. The bicarb is normal, and anyway, renal compensation would take a few days, so we don't expect the bicarb to be abnormal. The correct answer, therefore, is D, which is uncompensated respiratory acidosis. Question 3. A 60-year-old man with a history of depression has been found unconscious at home by his neighbor. When the paramedics arrived, he lay on the floor awake but unable to talk, making choking sounds. On examination, he appeared bluish purple, breathing slowly and shallow at a rate of 8 breaths per minute. Pulse was slow, body limp, and he had pinprick pupils. He was immediately administered naloxone. When he arrived to the ED, an ABG was done and showed the following: a PO2 of 8, a pH of 7.25, a PCO2 of 8, a bicarb of 24, and a base excess of +1. What does the ABG show? The low pH indicates that there is acidosis. The PCO2 is high and moving in the opposite direction to the pH, suggesting that the cause is respiratory. The PO2 is low, suggesting that the patient has hypoxia. Since both hypoxia and hypercapnia are present, the patient is in type 2 respiratory failure. The bicarb is normal, and as we know, renal compensation would take a few days anyway, so we don't expect to see an abnormality in the bicarb. So the correct answer to this question is B, respiratory acidosis with type 2 respiratory failure. Let's move on to the next question. Question 4. A 16-year-old boy presents to the ED appearing dehydrated. The mother says he has not been keeping very well for the last couple of months and missed school too. He feels tired all the time and has been increasingly going to the bathroom to pass urine, but she put it down to the increased amount of water that he has also started drinking. The urine dipstick shows a glucose of 3+ and ketones of 3+. An ABG done shows a PO2 of 12, a pH of 7.25, a PCO2 of 3, a bicarb of 18, and glucose 17. What does the ABG show? The low pH indicates that the patient is acidotic. The PCO2 is low and moving in the same direction to the pH, suggesting that there is a respiratory compensation for a metabolic cause. As the pH is low, a partial compensation has occurred. The PO2 is normal, the bicarb is low, suggesting that the cause is metabolic. The glucose is high, 17, which suggests that the patient may be diabetic and is currently having a diabetic ketoacidosis. So the correct answer in this question is C, a partially compensated metabolic acidosis. Question 5. A 65-year-old man, known COPD, has presented to the hospital with increasing shortness of breath. He reports a productive cough and change in his sputum color to yellow. His ABG shows a PO2 of 8, a pH of 7.25, a PCO2 of 9, and a bicarb of 30. His base excess is +5. The low pH indicates that the patient has acidosis. The PCO2 is high and moving in the opposite direction to the pH, suggesting that the cause is respiratory. The PO2 is low and patient is hypoxic. He has a type 2 respiratory failure due to the accompanying hypercapnia. The bicarb is high, suggesting that there has been a renal compensation for the imbalance. Compensation by the renal system takes a few days. This points to his condition being chronic. Given his history of COPD, the patient normally retains carbon dioxide and therefore has a chronically raised bicarb in order to maintain the pH. A low pH in this scenario means that the normal compensatory mechanisms are overwhelmed due to an acute illness. In a clinical setting, it would be helpful to compare with previous ABGs to identify the baseline readings and be able to make a comparison. So the correct answer to this question is D, type 2 respiratory failure, acute on chronic respiratory acidosis. Do keep in mind though that COPD patients retain carbon dioxide and therefore rely on the CO2 as their hypoxic drive. So it is necessary to give them the appropriate amount of oxygen and avoid over-oxygenation. Question 6. A 16-year-old girl presents to the ED with multiple episodes of dyspnea, palpitations, and tingling around the mouth, especially when she is in an enclosed space. An ABG done during one of the episodes is likely to show which of the following. A patient presenting with a panic attack would be hyperventilating. Therefore, their oxygen levels would be normal and they should present with an uncompensatory respiratory alkalosis. Therefore, the correct answer would be A. Let's move on to the next question. Question 7. A 70-year-old lady presents to the ED with a stroke. She received thrombolysis and went into a cardiac arrest. The ITU were able to revive her after 20 minutes of CPR. Her GCS has dropped to 8. An ABG done shows the following. PO2 is 8, pH is 7.3, PCO2 is 7, and bicarb is 15. How would you describe the acid-base balance? The low pH confirms acidosis. The high PCO2 confirms a respiratory cause for the acidosis. The low bicarb suggests that there is also a metabolic cause for the acidosis. Therefore, the acid-base balance is a mixed metabolic acidosis and respiratory acidosis. The respiratory acidosis has likely occurred due to a decreased respiratory drive as a result of impaired consciousness. However, it would also be crucial to rule out any brainstem pathology affecting the respiratory centers, since the patient arrested after receiving thrombolysis. That could have led to a cerebral bleed affecting the respiratory centers. This patient had a cardiac arrest, which meant there was a period of impaired ventilation and end organ perfusion. This has ultimately led to hypercapnia, causing a respiratory acidosis, in addition to the accumulation of products of anaerobic respiration as a result of hypoxia and reduced end organ perfusion, causing a metabolic acidosis. Therefore, the answer is D, a mixed metabolic and respiratory acidosis. Question 8. An 85-year-old lady, bedridden, presents from a care home with confusion. When examined, she appeared dehydrated and a foul smell was noticed from her diaper. She is febrile, 38.6. Her bloods show a high WBC count with neutrophilia. An ABG done shows a PO2 of 13, pH of 7.2, a PCO2 of 3, and a bicarb of 15. How would you describe the acid-base balance? The low pH indicates that the patient is acidotic. The PCO2 is low and moving in the same direction to the pH, suggesting that there is a respiratory compensation for a metabolic cause. The bicarb is low, therefore confirming that there is a metabolic acidosis. So the correct answer is C, metabolic acidosis with partial respiratory compensation, likely secondary to urosepsis. Question 9. A 30-year-old lady known to have generalized anxiety disorder presents to the ED with shortness of breath. She has also presented in the past with multiple episodes of panic attacks and is known to the emergency department. She says she has been feeling breathless since 8 hours and feeling very unwell. She also states that this episode feels different. An ABG done shows the following: a PO2 of 8, a pH of 7.55, a PCO2 of 3.9, and a bicarb of 22. What is the single most likely diagnosis? The high pH indicates alkalosis. The PCO2 is low, suggesting that there is a respiratory cause. The patient is hypoxic, suggesting a more serious pathology. The bicarb is normal. This patient has a respiratory alkalosis with a type 1 respiratory failure. So let's go over the options and exclude those which are less likely to be causing her symptoms. Methanol overdose would cause a metabolic acidosis. A panic attack leads to a respiratory alkalosis as well. However, this would never cause hypoxia. Diabetic ketoacidosis would lead to a metabolic acidosis. So the answer is D. A pulmonary embolism would cause someone to have a respiratory alkalosis secondary to the ventilation perfusion mismatch. This is why the patient is hypoxic. It is crucial to note that if a patient is hypoxic or not, as this will help differentiate between more lethal causes such as PE from a panic attack. Question 10. A 50-year-old lady presents with abdominal distension, pain, and profuse vomiting since yesterday. A CT scan done shows a mass causing bowel obstruction, and on examination she appears moderately dehydrated. An ABG done shows the following: a PO2 of 12, a pH of 7.55, a PCO2 of 5, a bicarb of 30, and a base excess of +3. What is the single most likely diagnosis? The high pH indicates alkalosis. The PCO2 is normal. The PO2 is normal. The bicarb is high, suggesting a metabolic cause. As a result of this patient's profuse vomiting, they have lost significant amounts of HCl, that is stomach acid. The parietal cells then produce more carbonic acid in response, and the hydrogen ions are then transported into the stomach to replace what was lost. The remaining bicarb is transported into the blood, resulting in an increase in free bicarb. In addition, as a result of vomiting, the patient is volume depleted, which results in the release of aldosterone and other mineralocorticoids, which in turn increase bicarb reabsorption by the kidneys, further increasing the amount of free bicarb in the serum. Therefore, the answer is D, metabolic alkalosis with no compensation. Thank you guys for taking the time out to listen. If you found this helpful, kindly subscribe to our channel and share the video so that others can benefit from it too. Click on the box appearing on the side that will take you to ABG topic discussion for a quick recap. All the very best. We can do this together.